A lot of people are getting cold and flu symptoms now, and everybody wants to know how can we reduce the symptoms, severity, and duration of the cold and flu. So, in short, TLDR, under 60 seconds, and then I'll dive into the in-depth for those who want to know. To summarize the research and meta-analysis, we're looking at 8 to 10 grams high-dose vitamin C orally, split dosages 3 to 4 times during the day for the duration of your cold, plus Andrographis, ideally taken either sublingually, the spray, or Armour Force do a great little concoction where they put olive leaf extract and zinc and other different ingredients in there as well to complete the package for reducing your cold and flu symptoms. Now, for those who want to know more, we're going to go into the research of actually how it works, why the dosages are that high, can it be effective at lower dosages, what about children, and other different nitty-gritty interesting science and meta-analysis summaries of vitamin C and Andrographis efficacy in reducing cold and flu symptoms. Okay, so let's start with vitamin C. That'll be where we spend most of our time. So vitamin C, it's a cofactor for helping make collagen, converting dopamine to norepinephrine. So it's important in the sympathetic, parasympathetic nervous system response. Helps make carnitine, which is uses fatty acids as energy, and helps make some immune cells like neutrophils. So very important. Found in high concentrations in the brain, so important for learning, executive function, memory. Now, to get to the cold and flu stuff, before we get to that, let's talk about why the high dose is needed. So we need about 220 micromoles to fill our cells and plasma maximally, average person. You can't really get the plasma levels above 220. Most people on average have about 60 to 75 baseline from dietary sources. Any more than that will contribute to pathways like collagen production. And why we need such a high dose is because the half-life of vitamin C is quite short. It is depleted and utilized quite quickly and restores back to a baseline or depleted levels quite quickly. So 1 gram of vitamin C increases baseline from about 60 to 175 micromolars. So 1 gram, 60 to 175. 2 grams will get you to 200. Now, in 24 hours later, you will get back to around your baseline. Hence the reason why we want frequent high dosages. Now you think, okay, 2 grams is going to get me to around that 200 micromolars. Why do I need to have such high dosages frequently? We're trying to maintain that 200 plus micromolars. We're trying to not let it get depleted throughout the day, which is why we see, it's why it's the most efficacious to reducing cold flu symptoms and duration in having multiple split doses throughout the day so we can have it above 200. So yes, you're going to have your fruits and vegetables, your citrus fruits, which are going to be rich in vitamin C. But outside of eating truckloads of fruits and vegetables, we're looking to supplement during this time to maintain a really high micromolar dose of plasma vitamin C. So even with taking supplemental oral doses of about 3 grams, taken 6 times a day, plasma vitamin C concentrations peak out at about 220. So they've tried really high split dosages. 220 is where we get it. Now, some risks. If you are prone to kidney stones, if you have any blood disorders, those are contraindications for high vitamin C. I won't go into mechanisms why, but briefly, one is the accumulation of oxalates as a result of high vitamin C's, which can contribute to kidney stones, and then blood disorders is a separate thing that I'm not aware of too much. However, now let's go into the science of how vitamin C is effective in reducing cold and flu symptoms. So, I need to stop knocking this mic. Vitamin C is highly concentrated in our immune cells. Like I said before, it's responsible for helping create neutrophils, which help mobilize and fight various infections and act like a defense system against other pathogenic bacteria. So neutrophils and leukocytes have 50 to 100 times higher vitamin C concentrations than plasma. And some studies have observed that even in critically ill patients, those with severe viral infections, plasma levels of vitamin C might be less than 25% of those observed in healthy people. So whether that's correlation or whether that's a causal mechanism that is contributing to worsening cardiorespiratory severe viral infections, that's not established or to my knowledge. However, we know there is a strong association there at the minimum, which is why intravenous vitamin C can actually be really effective at fighting and combating cold and flu symptoms. So if you have access to intravenous vitamin C, everyone can do it. You just make a call. There's companies out there that come to your home, they hook you up, and they pump you full of vitamin C. Okay, you invest in it, and we're talking concentrations as high as 15,000 micromolars per liter. This is the most seems to be the most effective way to reduce viral infections, particularly people with sepsis, which I'll go later. Has been effective. So this is like really amazing information to know, because you're going to probably know somebody. I'm probably going to know somebody who's going to be in maybe a life-threatening situation or a serious situation where you have some type of viral infection, sepsis, or serious cardiorespiratory infection. Well, why don't we use this knowledge, help potentially save lives, improve the quality of life that you're going to have when you're experiencing this illness? Why not? Okay, so this just in case information can be so valuable. Now, I don't have a lot of research on children, but it appears the evidence is more robust and consistent in vitamin C supplementation in shortening cold symptoms. I did say we have to titrate the dose based on their weight. We're not talking 8 to 10 gram eight gram dosages like we do for adults. We're talking scaling it back to about 1 gram. Now, none of this is medical advice. I'm summarizing literature and evidence-based practice from practitioners, doctors, scientists. That goes without being said, okay? But it still has to be said. Can we put that disclaimer on everything I say? Can we just do that until I'm a doctor or something? Probably they even have to have those disclaimers too. Anyway. So, actually, interesting little side note, vitamin C and cancer cell death, as actually there's associations there because they generate hydrogen peroxide, which is a type of reactant oxygen species that can damage DNA, RNA, and proteins. And studies suggest that high-dose vitamin C intravenously can assist in cancer cell death, primarily due to the formation of hydrogen peroxide, but that damage does not occur in normal healthy cells. But you see, it's really interesting because that damage will occur in typical cancer treatment, immunotherapy, and alike radiotherapy and alike therapies where it's indiscriminate. It will destroy healthy and cancerous cells, which can be quite debilitating, which is one reason why we see hair loss in some cancer patients. But vitamin C, it discriminates, which is pretty amazing, which can slow the growth of tumor cells. Now, these are in experimental murine models, so let's consider that is not humans. At least the study that I'm referencing. There may be other stuff out now. Now, let's finish off with I'm just going to shoot some research out. It's going to be below if you want to dive into it. I'm just doing a summary of it. 1. Extra dose vitamin C based on daily supplementation shortens the common cold. This is a meta-analysis of 9 randomized controlled trials. For those who don't know, 1 randomized controlled trial is the pinnacle gold standard typically for research study designs. And a meta-analysis, it's doing a meta-analysis of these RCTs. So a meta-analysis, it's doing a pooling and summary of the RCT. So if you want to know a consensus on a topic, look at meta-analysis. they're going to tell you the direction of where the evidence is heading. Instead of having to read each individual study yourself, we can look at some meta-analyses and see where the evidence is pointing to make some assumptions and decisions off. So supplementation was found to help reduce its duration of the cold. We saw a mean difference, an average difference of minus 0.56, which means, for those who need interpreting a confidence interval, that is a reduction of 43% of the duration of the cold. However, it looks like the confidence interval crossed 1, so the results may not be significant. And they are shown to relieve symptoms associated with chest pain by around 60%. Fever, 55%. And chills, or even more. Even more. What is that? Over 60%. I don't want to waste time doing all this math. So it seems like vitamin C is pretty efficacious. Some stuff may not be significant, but let's keep going, okay? Because again, it's about the totality of evidence, not about one particular data point. Another one, the effectiveness of vitamins, and that meta-analysis was done in 2018. The effectiveness of vitamin C in preventing and relieving symptoms of virus-induced respiratory infections. Guess what? I don't even want to say the word because people are getting blackballed on social media. So we all know what's been going around recently, that one. So that's a respiratory infection. Did you know that? And that can actually, let's apply some of that principled thinking into how vitamin C could maybe help that respiratory infection as well. Although you want to look at research specific to that particular infection, if you know what I'm saying. Anyway, in typical respiratory infections, 1,000 milligrams, so a gram, times 6, which they called a megadose, or typically it's called a megadose, for the first 6 hours of the study. And then, remember, just because the study, anyway, actually I won't even go there. 1 gram times 6, first 6 hours of the study, then 3 times a day after was able to dramatically cut the risk of the flu by 85% in 18 to 30-year-olds compared to standard of care over-the-counter decongestants and pain relievers. Pretty good. Pretty damn good. Now I don't know the confidence interval. I don't know if it crosses 1. Don't know if it's significant association is seen. But again, totality of evidence seems to be pointing that it's pretty efficacious. Now, what about intravenous vitamin C? Some of you are going to have, most of us are going to have access to it. Some of us will and won't be able to invest in it and justify it. But if it saves a couple of days and makes you more productive, and now you can get back to your day-to-day, improve your quality of life, every couple of years, probably worth the investment. At least I think so. Treatment with intravenous vitamin C reduced rates in patients with sepsis and severe acute respiratory failure. Now, this is a chance where maybe you're in a traditional hospital and you're not in a private hospital, and they're not doing maybe you're not in an alternative type of hospital where they're not doing these typical types of treatments. Actually, maybe I don't know. I actually don't know how common intravenous vitamin C is with sepsis and acute respiratory failure. Maybe it's more common than I'm letting on, or than I anticipate, but I just don't think it's that common. That's my assumption based on my understanding of the medical system. Anyway, so study 167 male and females, and they had sepsis. Excuse me, I'm the guy to dance now. Okay, so every 6 hours for 4 days, patients received intravenous vitamin C, 50 milligrams per kilogram of body weight. So it was relative. And 30% of patients who received intravenous vitamin C died. More than 56% of patients who received the placebo died. So we're looking at a 16% difference between placebo and vitamin C. Damn, you would not want to be the placebo in that case. That's 16%. Like that could be your loved one. Patients who received vitamin C also had fewer ventilated days, spent less time in ICU, 7 days versus 10, and their hospital stays were approximately 1 week shorter than those who received placebo. These findings suggest intravenous vitamin C administration might be beneficial in critically ill patients who have sepsis or respiratory failure. This is huge because this needs to be utilized, tested more, because you're talking about not only saving lives, but you're talking about relieving a burden of an overburdened medical system of doctors and staff and nurses and cleaners. And look at the 1 week shorter. That's 1 week shorter in something as common as severe respiratory failure, which is occurring who knows how many thousands of times a day all over the world. I assume it's that much. That could save a lot of money and time and energy and effort and hospital beds for other people. So that's great to see that. Last two. This is where I got the 8 grams from. Large dose vitamin C up to 8 grams per day may reduce the common cold. This is a 2017 study. We're looking at, they tested 6 to 8 grams. The 6 gram dose reduced cold symptoms by 17%. And that's roughly twice as much as those observed with only 3 grams. So I did 3, 6, and 8. 3 grams was about, let me do some math. 3 grams was, bear with me kids, 3 grams was about 8.5% reduction in cold and flu. 6 grams was 17% reduction. Placebo had no effect. And then we had 8 grams reduced it by 21%. So small differences, but the small, that could be a day, that could be half a day, right? That to be back on your game. So to me, that time is valuable. So 8 grams seems to be that spot, which I've personally been implementing, and no adverse effects noticed. And you don't know how much worse you could have been, because you can't be your own control group because you're only N of one person. So this is really a situation in case of, if you don't have any contraindications, what's the harm? There seems to be only a really high likelihood of upside based on the evidence, research, and, not even talking about anecdote. And then there's another study. Vitamin C may reduce the duration of mechanical ventilation in critically ill patients, and that was a meta-regression analysis. So really a lot of evidence on vitamin C in its efficacy for reducing cold and flu symptoms. 8 grams approximately seems to be the sweet spot. So we know right now in 2021. Now, when we couple that now with Andrographis, summarizing 2 meta-analyses, one from 2004, very simply, significant differences in outcomes suggested Andrographis is superior to placebo for alleviating symptoms of upper respiratory tract infection. And then most recently, the most recent other meta-analysis I could find was in adults and children, 2017. They looked at 33 randomized controlled trials with over 7,000 patients. It improved cough. What did they notice? Improved cough 10, the confidence interval was 10 to 33%, improving cough symptoms. It improved sore throat symptoms by, the mean was 13% improvement, but the confidence interval crossed 1. So researchers, again, they have a non-significant association, if I'm interpreting that correctly, when compared with placebo. So the conclusion, findings should be interpreted cautiously. That's reasonable. Owing to poor study quality and heterogeneity, which means heterogeneity, it's just been like the samples and results and methods were mixed. They were not similar. Homogeneity is we see like close similarity. Hetero, think male, female. Like you can be heterosexual or you can be homosexual. Heterosexual, that's how I remember it. Male, female, they're different. Homosexual, same. So that's how I remember homogeneity and heterogeneity. So well-designed trials evaluating the effectiveness need to be done. However, again, like this is where some critical thinking needs to be applied. The adverse effects of Andrographis, I looked at the meta-analysis of that as well. It's quite rare, and it's gastrointestinal related mostly. That's all I could see. So again, in these cases, I'm going to go my vitamin C, 8 grams, and then I'm going to couple that. My coach was talking about an Andrographis bioceutical supplement oral spray. Instead, you know what? Not even instead. You could do on top of Bioceuticals make Armor Force, which is a combination of ingredients including Andrographis, echinacea, olive leaf, vitamin C, and zinc, which all, I don't know about olive leaf. I haven't looked into that, but every other ingredient I've seen data, information on improving the immune system's ability to function and fight different bacterial or viral infections. So that combination, if we now go the Armor Force, if you really want to go hard at it, vitamin C, 8 grams, even better if you have access, intravenous. Couple that with Armor Force, high dose. I don't have dosages, but in these cases, use your own judgment. But in these cases, I err on the side of going more aggressive, double or triple dosing. Okay, I've done that many times with various supplements during different protocols. And once you understand the adverse effects, you look at the data and you test it on yourself, understand contraindications, then you make your judgment. I couple that with a high dose Armor Force, 2-3 times the normal recommended dose, and or a oral spray Andrographis, all taken together, split dosages throughout the day just to mitigate any potential toxicity in one hit dose. And you got your cold and flu symptom reduction severity concoction ready to go for the, what's the average, how many cold and flus does the average person experience in their lifetime? Even with regular flu vaccines, like if you get them every 2-3 years, a cold and flu, maybe some people get them every year. We're talking about 40 to 80 cold and flus. Well, so you could, and how long is the average person sick for? What, like really? It's average cold and flu. I'm guessing, 5 to 10 days. Let's split the middle. Let's call it 7. Let's go 7 times 40. That's 280 days. 280 days of your life that you could reduce by a quarter, potentially. Improve the quality of life by about a quarter of the time you'll be sick. To me, that's definitely something I would implement and consider in the management of cold and flu. So I hope that concoction is helpful. If you want to see more, you can subscribe on Strength of Saad on YouTube, on Facebook, Instagram, and the website strengthofsaad.com for all coaching services.